Good morning, good morning. Thank you everyone for joining us today. Today is Thursday, December 1st, 2022, and it is World AIDS Day. Today we are here at this wonderful event to just bring awareness to the current HIV crisis in our country, as well as in our community right now. We're here to give education, resources, and much more to our Bronx natives today as we highlight that there is more that is needed to be done when it comes on to HIV and AIDS awareness. Starting this morning will be our first speaker, Vanessa L. Gibson, Bronx Borough President. Borough President Gibson is the 14th borough president to serve the over 1.4 million residents and families that call Bronx their home. In keeping with Ms. Gibson's previous role as representatives in New York State Assembly, as well as councilperson in New York City's council, Ms. Gibson has continued her mission to move the Bronx forward with focus on public safety, food equity, housing insecurity, health and wellness, gender equity, health support for the LGBTQIA+ community, and equitable access to HIV prevention and treatment. Ms. Gibson now proudly represents the Bronx as the first African-American Bronx Borough President. Please welcome our Bronx Borough President, Vanessa L. Gibson.
Thank you so much. Thank you, Sandrine. And good morning, everyone. Buenos dias a todos. Welcome, welcome. I thank all of you for being here. Today, Thursday, December 1st, is World AIDS Awareness Day across the nation, in which we all get together to recognize the high prevalence of HIV/AIDS cases across the country. It is an honor to host the 2022 World AIDS Day event right here in our borough to fight against HIV and AIDS, to show support for our brothers and sisters that are living with HIV today, and to remember those who have passed on, who have transitioned from AIDS-related illnesses. I am proud to serve as the Bronx Borough President, Vanessa L. Gibson, and I am so grateful for all of you being here this morning. To all of our community partners and trusted organizations, credible messengers, trailblazers on the ground, we thank you for your commitment and your dedication to the Bronx and New York City, and we thank you for partnering with us today for this important event. I want to thank Boom Health that has mobile screening units and also giving out Metro cards for those that get tested this morning. Amida Care is here. They are tabling and responsible for the DJ. Shout out to the DJ. The New York City Commission on Human Rights. We are so grateful for Commissioner Annabelle Palma and the entire team at the Commission on Human Rights. We have the Osborne Association. We are grateful for you to be here today. Providing our coffee and COVID kits is African Services Committee. Thank you so much to the African Services Committee for joining us today. We also have with us doing tabling Black Health. Thank you so much, Black Health. Also tabling is another great partner, the Latino Commission on AIDS. Thank you so much to the Latino Commission. Also tabling with us, another great partner, Callan Lord, who has a health center in the South Bronx, and we're looking to expand. Also tabling our Bronx LGBT site, Destination Tomorrow, DT. And also doing tabling is our anti-gun violence organization, Credible Messenger, Bronx Connect, RTG, Release the Grip. Thank you so much. All of you are so incredibly important and essential in our fight to combat stigma and all of these diseases. We are inspired every day by your work in the community, every day on the ground, and we're so proud to partner with you to end HIV, to end the AIDS epidemic, and to bring real change, transformative change, and better the lives of all of our Bronxites. You would not believe, but here is the data. Right here in the Bronx, as of December 2021, there were 31,035 people living in the Bronx with HIV. Right now, 31,000. That's a lot of people. Every year, hundreds more are newly diagnosed cases, and many are our loved ones and our family members and our friends. This epidemic is not over. In addition, our African American, Hispanic, Latino, Latinx, LGBTQIA+ communities, immigrant communities face the greatest social stigma and suffer the most. Stigma is especially severe for many of our brothers and sisters who experience intersectional stigma for holding identities across systemically oppressed races, sexual orientations, and socioeconomic statuses. And it often prevents these vulnerable communities from receiving preventative and treatment services. Significant work must be done collaboratively, and we need all levels of government, federal government, state government, and local government, all of our CBOs and non-for-profits, to ensure that every person is comfortable in being identified to seek services without fear of being labeled or discriminated. It is real. Many people fear coming forward. They have anxiety. They're traumatized. They don't want to know their status because of what is associated with being HIV status. This starts with going into communities, talking to trusted partners, talking to sex workers and those industries where we know there are vulnerable clients that we must reach. It means occupying the blocks and corners, talking to folks. We don't expect everyone to show up at our office. They are not necessarily coming to us, so we have to go to them. And yes, even in the wintertime, we will go to our clients. My office has been committed to raising awareness and collaborating with organizations and city agencies to support and amplify the work, and we will continue this fight. We have an HIV/AIDS roundtable, and we have been able to work with the Department of Health and work on sharing data. I am pleased to announce that the Bronx Borough President's Office earlier this year, we relaunched our HIV roundtable to establish and solidify borough-wide networks of community partners who are on the ground every day providing compassionate, comprehensive, culturally sensitive services to end the epidemic. We held our first meeting this year in September, and our second will be this month. December. We are thrilled with the outpouring of support and all the enthusiasm and energy that we are seeing to connect and collaborate. My office is committed to working with all of our residents across the borough and partners on our HIV roundtable to increase access to HIV preventative and treatment care, and to reduce the stigma, to end the stigma and all the barriers associated with accessing care. We are also excited that the New York City Department of Health and Mental Hygiene released the latest New York City-based HIV/AIDS 2021 data on this past Tuesday of this week. Data like this drives our evidence-based efforts to meet the needs of all New Yorkers and all Bronxites. We are grateful to the Department of Health for their constant efforts to provide us with detailed and accurate information and statistics. But guess what? Those statistics can turn into success stories as we keep people alive and healthy. Knowing your status is the best form of preventative care, right? Would you all agree? Knowing your status. If you are in an intimate relationship, you and your partner should get tested together. Go together. Go on a date and get tested together. It's all right. We're redefining what dating means these days. But we truly must continue this work. We must continue this work. While today is World AIDS Day, our work continues all year round until we end this epidemic in the Bronx and the city and the state. And so it is my great honor hereby, as the Bronx Borough President, to issue a proclamation establishing December 1st through December 7th as our annual World AIDS Week in the Bronx. You know, we like weeks in the Bronx. We have Bronx Week, we have Restaurant Week, and so now we're going to have World AIDS Week in the Bronx. From December 1st through December 7th of this year, we will be promoting HIV/AIDS related services and events hosted by all of our partners that stand at my side and all of the work of our city agencies. The Bronx Borough President's Office is truly committed to advocating for the most effective and equitable policies at a borough level, city, and state level that align with all of our efforts and our priorities in this dedicated and life-saving work. I hope that all of you share this information. Our colleagues in the media, we need you to share this information. The best way that we prevent additional HIV infections is by spreading accurate information. Education, empowerment, and enrichment. It makes a difference. If we do anything in this world, in this life, we have to do something to save lives, to keep people healthy, well, and safe. With all that we have experienced, from COVID to monkeypox, now called Mpox, to everything, to RSV, this nuance of chest colds and compressions and things of that nature, other health issues, to the work we do around diabetes and lupus and fibroids and maternal health care. We're doing all of this work, mental health, therapeutic services. We also have to make sure that we're focused on HIV and AIDS. So I am grateful to serve as the borough president, but I'm equally grateful for all the partners that you see at our side that support this work, that do this work every single day in the trenches. It's not popular, but it is necessary. Only by working together will we truly end the epidemic, right? Say it with me. End the epidemic. 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 Thank you, everyone. Thank you, Sandrine.
Thank you, Borough President Gibson. Can I get another round of applause for Borough President Gibson? We thank you for your commitment to us here as Bronxite, for your health awareness and education and resources that you continue to provide to us. We also want to acknowledge Gail Brown from the COPE organization for the wonderful work that they continue to do for HIV and AIDS awareness. Our next speaker will be Tabitha Gonzalez. Tabitha is the Associate Human Rights Specialist and Transgender Community Liaison for New York City's Commission on Human Rights. The New York City Commission on Human Rights is charged with enforcement of the human rights law. The Commission also provides public education about human rights laws and helps cultivate understanding and respect amongst the city's many diverse communities throughout its borough-based community service centers and numerous educational and outreach programs. The Commission utilizes restorative justice principles to address the harm caused by discrimination and bias, both in its handling of complaints and in its community partnership. Here today on behalf of the Commission is Tabitha Gonzalez. Tabitha?
I'm sorry. It was a little cold. I went to catch some heat. All right, give me a second. How is everyone doing? Is cold enough for you?
Yes.
Yeah, they're like, you ain't got to say that again. All right, I'm just going to pull this up. My name is Tabitha Gonzalez. I'm the Trans Communities Liaison and Associate Human Rights Specialist in the New York City Commission on Human Rights. The Commission on Human Rights is here for anyone who was discriminated against, be it in housing or on the job or out in public, for having HIV. Despite new treatments and modes of prevention, HIV and AIDS continues to be a pandemic, especially among communities of color. For over 40 years, HIV and AIDS has ravaged our world and our nation, with New York as an early epicenter. We have shown the world how to combat, not just the disease, but also the stigma. We are here to ensure that people with HIV do not experience discrimination. And today, on World AIDS Day, we must continue to come together. LGBT, trans and non-binary, men and women of all communities come together and of all ages and fight against this epidemic of HIV. Thank you. Okay. I don't do this a lot. I'm sorry.
Thank you so much, Tabitha. Coming up next is Alex Fontanez, who is the Assistant Director of Partnerships at Amida Care. Amida Care is a private, non-for-profit community health plan that specializes in providing comprehensive health coverage and coordinated care to Medicaid members with chronic health conditions, including HIV and AIDS and behavioral disorders. Amida Care currently serves 8,500 members throughout the 5 boroughs of New York City, including people living with HIV and AIDS, people who are experiencing homelessness, and people of the transgender experience, regardless of their HIV status. Here with us today is Alex Fontanez.
Good morning, everybody. Thank you. Thank you all for being here, and thank you, most importantly, to our Bronx Borough President, Vanessa Gibson, for being a proud supporter for us, and also to Amida Care. Thank you very much. My name is Alex Fontanez. I'm the Assistant Director of Partnerships and the Plans Ombudsperson for Amida Care. Amida Care is the largest special needs health plan in New York, which specializes in caring for people affected by HIV. Amida Care provides comprehensive health coverage and services to people living with HIV/AIDS. People of transgender experience, regardless of HIV status, and people who are homeless, regardless of HIV status as well. We are the HIV and gender-affirming care experts. Thanks to the leadership of elected officials like Bronx Borough President Vanessa Gibson, New York State has made numerous progress towards ending the HIV epidemic. But on this World AIDS Day, a day dedicated to raising awareness for the AIDS epidemic, it's important to note the work that still needs to be done. PrEP is a game-changing medication that has proven 99% effective in preventing HIV transmission if taken as prescribed. For people who are HIV negative, we need to increase PrEP usage, especially among Black, Hispanics, and other people of color. Amida Care covers PrEP for our HIV negative members in New York State. PrEP is covered by Medicaid and most health insurance companies, without co-pays for medicines, lab work, or clinic visits. PrEP usage is critical in ending the HIV epidemic in New York, especially among populations most deeply affected by HIV, which I said before are Black and Hispanic and other communities, including the LGBT plus community. And most importantly, women of color and transgender women as well. I'm going to bring it back to Sandrine. She's going to give you a couple of more statistics as well. Sandrine is my colleague that works at Amida Care as well.
Thank you, Alex. Thank you so much. Again, my name is Sandrine Blake. I am the Assistant Director of Events with Amida Care. There are still a lot of misconceptions and stigma associated with HIV, and in turn, PrEP use. HIV can infect anyone, so it's important to know that PrEP is for everyone, including women. We can't have a conversation about men and their status and not include us. Black women continue to be disproportionately impacted by HIV, accounting for nearly 60% of all new HIV infections for the U.S. women's count. We have to make it known that PrEP is for them as mothers, sisters, fathers, brothers. We're talking about PrEP for men of color. We must also extend the conversation to women as well. There should be no shame in talking about your health and taking preventative measures. Talk to your family, your friends, your neighbors, and especially our young people of all genders and sexual orientation, and just remind them that it's okay to take PrEP. PrEP is a thing, it's the thing to do right now, and your health is wealth. We can't do this without our community, and it's very important for us to understand this. We encourage you today to get tested, to learn your status, and to talk to your healthcare provider if you do decide to take PrEP. Coming up next will be our next speaker, Victoire McCorkle. Victoire is the, one moment. Sorry about that. Coming up next is our next speaker, Victoire McCorkle, who is the Senior Health Navigator at Amida Care and Ambassador with HIV Stops With Me. Victoire, please step over.
And testing is prevention. Sandrine, you done gave me a microphone. I don't know. I guess I'm here to tell my story. First off, my name is Victoire McCorkle, and I'm actually the supervisor of peer programs at Amida Care. A title I fought very hard to get, so I'm very proud of it. I appreciate you though, Sandrine, I really do. My name is Victoire. I'm a proud Bronx resident. Thank you for all the work that you do. We really appreciate you. We really, really do, especially at Amida Care. Anyway, I'm not going to cry today. I found that I was HIV positive about 20 years ago. I was 26, and I couldn't tell you who gave me the virus, but I know that I contracted it through unprotected sex. I was young. In my late teens and early 20s, I was promiscuous. I don't even like using that word, but I was out there. I was living my best life, and I thought I was smart. I thought I could tell if somebody was sick or I was going to get something, you know. And even when I got tested, it wasn't because I was sick or I thought I might be HIV positive. I was homeless, and I needed a place to stay. And the organization that offered to test me was going to give me that, whether I was positive or not. So I took the test for a place to stay, and even when I got my results, I had mixed feelings. On the one hand, I was devastated. With my understanding of the virus at that time, I thought I was going to die before I was 30. But on the other hand, I was relieved because I had a place to stay that night. So even if I was going to die at 30, at least I'd do it in a warm bed. You know what I'm saying? And the organization that tested me and gave me my post-test counseling was an organization built to meet my needs. An organization built to meet a gay black man where he was at with this virus. And thanks to organizations like that and organizations like Amida Care, I'm where I'm at today. I'm undetectable. I can't pass this virus off to nobody else. That's a beautiful thing, something I never thought would happen when I was first diagnosed. I love the work that I do at Amida Care. I started here as a peer worker, meaning I shared my story with people who were newly diagnosed to help them move up in their own health, to help them get to a point where they were undetectable and they can go back to work and they can be productive members of the society. That's what I get to do, and I love my work. I've been with Amida Care for about 10 years, and now I'm a supervisor of peer programs, so today I get to train other people to do what I did when I started this work. I want to thank everybody for being here. There's a few talking points that I do want to hit. Though the number of New Yorkers diagnosed with HIV has dropped, it's still high amongst black and brown people, specifically women. HIV is still here. It's still stigmatized. There's still a lot surrounding it that people just don't know, which is why I joined the HIV Stops With Me campaign. Our focus is real simple. Break stigma around HIV. People don't think that you can live a full and healthy, happy life with HIV. I'm here to prove you wrong. I've been doing it for 20 years. The work that is done in this community by these community-based organizations are essential. We need people like our borough president who's going to support us in doing this work. It needs to be done. Even today, yes, we've made a lot of progress with the medication. I can take a pill a day. If I wanted to, I can go and get a shot every 2 months. But it's still here, and it doesn't have to be. So let's keep fighting. I want to say get tested, and regardless of your result, engage in healthcare. It's going to help you. Get PrEP if you're not positive, and get treatment if you are. Have a beautiful day. Thank you for being here. Happy World AIDS Day.
Thank you, Victoire, for your open and transparency. We appreciate you sharing. And we thank everyone for coming out for today's World AIDS Day press conference. But we want to encourage you, please stop at the tables, take up our resource information, talk to our organizers out here, stop at the vans, get tested, know your status. We thank you guys today, and we just want to acknowledge this great proclamation that the Borough President has done on today, World AIDS Day. We thank you, Borough President Gibson, and we thank you.
Okay, so thank you everyone for coming out. And again, this is just the beginning. I also want to acknowledge that we have Fidel Molina on behalf of our governor, Kathy Hochul, and I want to recognize the governor and the state legislature for the tremendous amount of money that has been allocated to many of our organizations and partners right here in the Bronx. Thank you, Fidel, for being here on behalf of our governor. And this is a proclamation that we came up with, the team, the health team, the entire office, the communications team, just to recognize that each year we amplify, we recognize, and we support the plight of those affected by HIV/AIDS throughout the borough, the city, the state, and the nation. And right here in our borough, we are lifting up the 31,035 Bronxites that live with HIV today. And every year, the many who are newly diagnosed. Today's event marks another day, another week, another moment for us to advocate for those affected by HIV/AIDS, regardless of their race, their gender, their socioeconomic status, but the fundamental right, the right to receive high-quality, patient-centered care that is attuned to their unique needs. We also celebrate our healthcare advocates and our champions and community-based partners for their work every day in our partnership to end HIV, to end the stigma, to end the AIDS epidemic, and bring about lasting change that will better the lives of all Bronxites. So now, therefore, I, Vanessa L. Gibson, Bronx Borough President, on behalf of the residents of our county, we do hereby proclaim December 1st through December 7th as World AIDS Awareness Week in Bronx County. Yes. Thank you, everyone, and thank you, advocates. Thank you, champions. Thank you, thank you, thank you for all you do. Let's continue to save lives, right? End the epidemic. Get tested. Thank you so much, everyone.